Welcome to our channel. Today we're diving into the world of eye and vision diseases. Our eyes are incredibly important. They let us see the world around us, and that's why taking care of them is key. We're going to learn about some common eye conditions that can affect people of all ages. Now, don't worry, we're not trying to make you eye doctors or anything, but we do want to give you some helpful information. This video is all about understanding these conditions so you can be proactive about your eye health or help a family member who might be experiencing these issues. Remember, if you're ever concerned about your vision or experiencing any problems, it's super important to talk to your parents and see an eye doctor right away. Early detection is key when it comes to treating eye diseases effectively. Let's start with refractive errors. These are pretty common, and they basically mean that the shape of your eye isn't quite right for focusing light properly. This can make things look blurry, whether you're looking at something up close or far away. There are a few different types of refractive errors. Nearsightedness, or myopia, is when you can see things up close clearly, but things far away are blurry. Farsightedness, or hyperopia, is the opposite. You can see things far away clearly, but things up close are blurry. Astigmatism is another refractive error that happens when the cornea, the front part of your eye, is curved unevenly, causing blurry vision at all distances. Presbyopia is a type of far-sightedness that usually happens as we get older, making it harder to focus on things up close. The good news is that refractive errors can usually be corrected with glasses, contact lenses, or in some cases surgery. Next up, let's talk about cataracts. A cataract is like a clouding of the lens in your eye. Imagine looking through a foggy window. That's kind of what it's like to have a cataract. Things might look blurry, hazy, or less colorful. Cataracts usually develop slowly over time, and they're more common in older adults. In fact, cataracts are the leading cause of blindness worldwide. But the good news is that cataracts can be treated with surgery. During cataract surgery, the cloudy lens is removed and replaced with a clear artificial lens. It's a very common and generally safe procedure that can significantly improve vision. Now let's move on to glaucoma. Glaucoma is a group of eye diseases that damage the optic nerve. The optic nerve is like a cable that connects your eye to your brain, carrying signals that allow you to see. Glaucoma often develops slowly and without any noticeable symptoms in its early stages, which is why it's sometimes called the silent thief of sight. Over time, glaucoma can cause peripheral vision loss, meaning you lose your ability to see things out of the sides of your eyes. If left untreated, glaucoma can eventually lead to blindness. The good news is that early detection and treatment are crucial for preventing serious vision loss from glaucoma. Regular eye exams are essential for catching glaucoma early. Age-related macular degeneration, or AMD, is a leading cause of vision loss in people over the age of 50. AMD affects the macula, which is the central part of the retina, the light-sensitive tissue at the back of your eye. The macula is responsible for sharp central vision, which we use for activities like reading, driving, and recognizing faces. There are two types of AMD, dry AMD and wet AMD. Dry AMD is the more common type and develops gradually over time. It happens when the macula thins and small clumps of protein called drusen form. Dry AMD can cause blurry central vision, making it difficult to see fine details. Wet AMD is less common but more serious. It happens when abnormal blood vessels grow under the macula. These blood vessels can leak fluid and blood, causing damage to the macula and rapid vision loss. Finally, let's talk about diabetic retinopathy. This condition is a complication of diabetes that affects the eyes. Diabetes is a disease that affects how your body uses sugar for energy. High blood sugar levels over time can damage blood vessels throughout the body, including the tiny blood vessels in the retina. Diabetic retinopathy occurs when these blood vessels in the retina become damaged. They may swell, leak fluid, or close off completely. In some cases, abnormal new blood vessels can grow on the surface of the retina. Diabetic retinopathy can cause blurry vision, floaters, small spots or specks that drift across your field of vision, and even vision loss. Managing your blood sugar, blood pressure, and cholesterol levels can help prevent or slow down diabetic retinopathy. Thanks for watching. We've covered a lot of ground today, learning about different eye diseases. Remember, taking care of your eyes is just as important as taking care of any other part of your body. Regular eye exams are like checkups for your eyes. They can help detect problems early on when they're often easier to treat. And don't forget about those healthy habits. Eating a balanced diet, getting enough sleep, and protecting your eyes from the sun can all contribute to good eye health. If you have any questions or concerns about your eye health, don't hesitate to talk to your parents or an eye doctor. And make sure to like, share, and subscribe for more informative videos. See you next time.